About 80% of rare diseases are thought to have some genetic component. And many of those are sort of the classic single gene Mendelian disorders. So you get two abnormal genes and you develop symptoms where if you have only one of them, you don't. And often those are disorders that have they're rare, and they can have their presentation early in childhood. So I think just based on the types of disorders that happen to be rare, they tend to be things that affect children. I think the other reason that, pediatric disorders are more likely to be rare disorders is that, on the whole, kids are pretty healthy. So you see a lower percentage of children affected by any disease, whether it's genetic or not, and so they're more likely to be rare diseases. For example, all pediatric cancers are rare diseases, just based on the fact that it's pretty rare for kids to get cancer, even though it does occur. So I think that's the other reason that rare diseases have a particular impact on the pediatric population. In the world of genetic disorders, we've got a number that are, multi-genic disorders that where a number of different factors are associated with the development of disease. Some of those are rare diseases, some of those aren't. In contrast, you can have some of the single gene disorders that cause these classic Mendelian inheritance disorders. The diseases that tend to affect children tend to be the single gene disorders, whereas your more complex inheritance disorders tend to be ones that cause later life diseases like mental health disorders, heart disease, other cardiovascular disease. And as it turns out, I think, though it's not very low-hanging in the whole scheme of things, I think the lowest hanging fruit in terms of coming up with solutions is these single gene disorders, particularly when you're talking about, the absence, when the mutation leads to the absence of a particular gene product or protein. So if you can replace that product, whether it's through giving the protein directly or using exon skipping technology to kind of replicate the gene function, you can basically put correct the underlying cause of the disease. And if you can do that early enough before any sort of, long-term consequences have happened, that's when you'll really see benefit. So that's why I think most of the, many of the targeted medicine solutions we've seen have been for these pediatric diseases that are kind of single gene in nature.